Hi, good afternoon, everyone. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. It's good to see you all. I know people are still kind of trickling in from the waiting room and probably will for a few minutes, but we appreciate you joining us on this lovely July day. I know a lot of people are out on vacation right now, so we're probably going to have a smaller group, but we have, as usual, I feel like broken record, lots of updates to share, state and federal policy updates, like always, everything that you need to know about the status of Kentucky's safety net programs. And for the first time, we also have a legal update for you from our friends at the Kentucky Equal Justice Center. So we're excited to share that. And I know that most of you are familiar with Thrive Kentucky right now. These are members of the campaign who participate in these webinars and provide the updates. We can go to the next page, Kelly. For anyone who is joining us for the first time today, welcome. And here's some good information for you about our campaign and how we do our work. So these are the guiding principles. Our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. So these are the principles that guide that work, the policy advocacy that we do together. And if you want more information about any of our organizations, you can click on these links to learn more. And always want to say thank you to our 2023 Thrive Kentucky sponsors. These sponsors help us to put the webinars on, and actually our roadshow, which I'll talk about in a minute, for free. We provide all of this education and the training that we do for free, and we're able to do this every month because of the support that we get. So we appreciate that. And we accept sponsorships anytime throughout the year. So if your organization is interested in becoming a sponsor or just learning more, you're welcome to reach out to Kelly. You can see her email address there, and I have a feeling she'll be dropping that in the chat at some point. So I mentioned our roadshow. This is where we actually come to your community and your region of the state and do a little bit more of an extended version of our education on these different safety net topics, the basic needs that Kentuckians have, and the policy advocacy opportunities that exist in areas where we're working. And then we also include an advocacy training component to that, so that we can really talk about the issues and talk about what the solutions are, and then how we can work together to advocate for better policies that are responsive to the needs of Kentuckians. And so we have had 3 great roadshow events so far. Our 4th is coming up next week, July 18th in Hazard. We're very excited to be, visiting Hazard for the first time since, were we there last year, Kelly? No, that's right. I think it was 2019 when we did our roadshow, took our, pandemic hiatus, and then we're coming back. So that's going to be a good one. And then we have 4 more after that. You can see here Moorhead, Louisville, Lexington, and Paducah. And you can get more details about the agenda and the schedule and everything else at that link. So we hope you'll join us there. And for today, this is our agenda. It's a long one. So I'm hoping that we can get through all of it. If not, as always, we send out slide deck, we send out all the materials and resources that we share. And if there's anything that we're not able to cover at length, then we'll make sure that you get that information in a follow-up email. So during each of these sections, put any questions or comments that you have in the chat. We'll try to get to it as we go. We find that works better than waiting until the end of a particular topic or the end of the webinar. So we'll try to just, get those chat questions and get you the answers that you need. And like I said, if we have more than we can touch on in the next 90 minutes, we'll follow up with you in an email that comes out either tomorrow or on Thursday. You'll get the recording as well. And we'll also be sending you an evaluation, because we always want to know what information is helpful, what's not so helpful, what you want more of, less of, and any ideas you have for future webinars. So with that, let's go to the next slide. I'm going to turn it over to Kelly to give us an update on the interim.
Hello, my name is Kelly Talby. This will be quick, and for those of you who join us often, a lot of these interim updates are not new. The Medicaid regulations pertinent to dental, vision, and hearing services. These are currently in place, and it's important to note before I get into anything else of this week that the services are available to Kentuckians through the end of the year at least. We hope and are working for a permanent solution. We hope to see more permanent policies in place. But because there has been kind of some political melee over the application of these regs, and in May they were found deficient, as some of y'all may recall. There is a meeting currently scheduled for this Thursday where there will be a hearing to take them up yet again. We are preparing and planning on being there. I know the cabinet is also preparing and planning on being there. But for the purposes of any client you're working with who may have concerns because of the activities in Frankfort, please know that those services are available at least through the end of the year. And again, we hope for a more permanent placement of those services moving forward. But I want to use that. We usually do this slide at the end. Dr. Schuster does a nice plug on why it's important and how to stay in touch with your legislators through the interim because of the hearing this week, because these regulations and how it impacts almost 1 million Kentuckian adults right now. This is a perfect opportunity to reach out to legislators, whether you know them or getting to know them for the first time. Here's everything you need to know again about how to access them publicly. If you live in their districts, reach out to them at home. It cannot be more important to stay involved. Most of this summary is not new, but I wanted to highlight 2 main changes since we last met. There was the vacancy of Chair Alvarado, formerly of the Health and Family Services Committee. He was appointed to the Tennessee Public Health Commissioner's post, and that opened up a primary election. So the primary election in May also hosted a special election. So it was treated like a general. Greg Elkins was elected to serve the remainder of that Senate District 28 term. And he has already been appointed to some very impactful committees: health services, families and children, state government, local government. He's new. And so again, to the point of how important it is to stay involved and communicating with legislators on those committees, hearing these issues, that is a perfect opportunity to reach out to someone new and just get to know them. Bills without emergency clauses or bills that did not have a separate implementation date assigned to them within the bill language itself all became effective June 29th, so a week and a half ago. That is by official opinion of the Attorney General. And so that is why July 1st is always kind of a big day in odd number year sessions. This is just a quick recap of the balance of power in the current state legislature. It is predominantly Republican, and there's yet another vacancy. Unfortunately, we lost a representative. He passed away about a month and a half ago. So on the general election in November, House District 93 will be filled. This is just some recap context for the 2023 interim. It did officially begin June the 1st. And while no legislation can be passed without, albeit the call of a special session, again, I'll keep referencing those Medicaid regulations because it's a good example of there's still policy and actions being taken. It is still important to stay involved. A lot of these interim committees do meet monthly, and they have created a slew of special committees and task forces like they do every year. And this is really where folks like us get a sneak preview of what the priorities for the state legislature will be the coming session. These task forces kind of focus on more specific issues, or it's an elongation of previous task force work that is incomplete. And they continue to do these studies. They continue to do deeper dives. The Kentucky Health and Human Services Delivery System Task Force is a big mouthful, not quite as much as the Multimodal Freight Transportation System Improvement Task Force. But each of these groups will be meeting at least a few times during the interim and will be submitting reports no later than December the 4th, some of them earlier than that. This first one, the HHS Delivery System Task Force, this is kind of an elongation of last year's Benefits Cliff Task Force, as well as the CHFS Reorganization Task Force. They have only met once, and the School and Campus Security Task Force, it's our understanding they'll be taking up quite a few behavioral health, mental health issues within their conversations about how to approach school and campus security. So that is one to watch. Last year, with all of the focus on jail and correctional reform, especially in response to the Department for Juvenile Justice issues, this task force will continue the work in improving Kentucky's jail and correctional reform delivery. The Certificate of Need Task Force, this has become kind of an isolated focus, and many states around us are also giving a closer look at their certificate of need process and reevaluating, are we doing it right? Are we doing it at all? Should we be doing it? So this is one to watch, since in Kentucky, there's such a vast difference in the delivery of care, whether you're in rural Kentucky versus an urban center. Lottery Trust Fund, this is a restricted fund that often supports many educational programs, so it could impact quite a bit if they begin to adjust how that fund is used. And then these last two here, maybe not so much of a focus for Thrive Kentucky per se, but still equally important. And, I kind of personally raised a big eyebrow at the multimodal freight transportation system one, but then it is not lost on me that just a few months ago, Northern Ohio faced incredibly terrifying circumstances with some freight issues. So it's important, and it's environmentally impactful, and it does affect our communities that these services are maintained safely. The 2023 interim calendar is updated often. So any of these interim committees, any of these task forces, all of these are hyperlinked when you get the slide deck, so you can see who's on these groups, when they meet. That link here at the bottom, that's the best way to keep up with the changes, because almost 3 times a week right now, they are still adjusting that interim calendar. And that's also important. Just keep in mind, this is an election year. I've highlighted here the next election threshold, which feels like a long way off, but it is only 91 days away. We are less than 100 days away from that voter registration deadline. So whether it's yourself, others you know, or the work that you do, don't lose sight of the democratic process and why every vote should be counted. And so please get your registrations in on time. And that is the short and skinny interim update. And I will pass the virtual mic back to Emily.
Thank you, Kelly. I am never ready to hear that we're 90 days away from
Ever, never, ever.
You're ready. Okay. Well, I want to give you all an update on certified community health workers and Medicaid reimbursement. This is something we've talked about a lot on these calls, obviously something that Kentucky Voices for Health supports. And we've been really excited about this progress that we've been making to, expand Kentucky's network of community health workers by providing this new reimbursement opportunity. And it really helps us to provide, a more sustainable pathway for CHWs to be working in their communities. And so this bill, House Bill 525, that was passed during the 2022 General Assembly, has gone into effect. Medicaid billing started officially on July 1st. So that's great news. I actually feel like I might have the best section of this agenda for today, because it's really all good news. And that means that certified CHWs, of which I believe there are now about 200 in Kentucky, can bill Medicaid, but of course have to be working with a Medicaid provider. And there are lots of requirements around Medicaid billing. So I doubt that many are, quite at the billing point yet, but this is an area where I think we're going to continue to see more CHWs getting involved, and really hope that a lot of providers are looking closely at this and looking at the opportunity to hire community health workers or expand their CHWs if they already have them on staff. So I wanted to share with you a little bit of information to help you get started if you are a Medicaid provider, or if you're a community-based organization and you're thinking, do we want to enroll as a Medicaid provider if we have somebody on staff who, is licensed and is an eligible provider type, or do we want to contract with an eligible Medicaid provider type so that we can participate in this? So what you have here, links to the approved state plan amendment that's been approved by CMS. So this allows for CHW billing. Then there's a certification process. Now that's regulated by the Department for Public Health, but for CHWs who want to be certified in order to, and that's a community health worker. For CHWs who want to be certified in order to bill, that's information on how you can follow those steps. And then there is an overview of the billing process that was created by DMS, the Department for Medicaid Services, for frequently asked questions, a letter that's already been sent to Medicaid providers, and a letter that's been sent to dentists, Medicaid participating dentists. And so links to all of those materials are here for you. And then coming soon, something for us to watch for is the CHW billing regulation. It has not been filed yet, but regardless of the regulation not being filed, because the statute, the law, House Bill 525, stated July 1st as the implementation date, and CMS has approved it for July 1st, you can start billing. So just keep that in mind. And then billing manuals, the Medicaid billing manuals will be updated soon. So something else to watch for. Kelly, we can go to the next slide. So in terms of covered services, there's a lot that community health workers can do with Medicaid billing. 3 codes, but the services provided touch on a lot of things that CHWs are already doing: preventive services, health promotion and education, being a liaison between the client and the provider, helping people navigate the healthcare system, and finding resources that they may need, transportation. So these are things that most CHWs are doing in one way or another, and these are things that can be billed for. Patient education, and education specifically around things like immunizations, managing chronic conditions, things like blood pressure, diabetes, that kind of thing, managing STDs, and really looking at prevention and focusing on that. And then health promotion and coaching. So things like tobacco cessation, reducing, the use of alcohol or drugs, and looking at things like fitness and nutrition, taking care of your family. There are lots of ways that CHWs can support their clients in improving their health and well-being and bill for that at the same time. So we can go to the next slide. In terms of guidance, these are the 3 codes that CHWs can bill for, and the codes are really for any of those services, but the difference is whether it's 1 patient, 2 to 4 patients, or 5 to 8 patients, and you get a different payment rate based on how many patients or clients you're serving at a particular time. And these are all in 30-minute increments, which I forgot. Oh, no, that is on the slide. So 30-minute increments. There are a few other important details to keep in mind. There is no restriction on place of service. For anyone who's been kind of paying attention to this, at one point, DMS was going to limit this to services being provided in the walls of the clinic. That is no longer the case. CMS was able to help them find codes that could work inside or outside a clinic setting. So there is no restriction on place of service, which is fantastic. That's also in line with what community health workers do. They work in their community. And that allows for community-based organizations to be more involved. Now, again, if you are a community-based organization, if you're not a traditional Medicaid or healthcare provider, then you will have to be enrolled as a Medicaid provider that would be eligible to participate in this, or contract with a Medicaid provider. CHWs aren't going to be the provider, that is ordering the service. They will be providing the service, but a Medicaid provider like a physician or a nurse practitioner, there are a number of Medicaid providers that would be actually ordering the service. And so the CHW bills under that provider, if that makes sense. Other important details, there's a max of 2 units per patient per week. That's not really a lot of time, that's 1 hour. So if you think about some of your clients who have a lot of needs, maybe multiple appointments a week, or just need additional coaching or assistance navigating the healthcare system, 1 hour may not cut it. This is an area where I've had some conversation with DMS. They will consider looking at expanding that at some point. So I think they're going to need to hear from us. They're going to need to hear feedback on, what is, a little bit more realistic. What do people really need? Should we change this in some way? My thought is, even if we were to limit the number of units to 104 per year, why do we need to limit it to 2 units a week? Maybe that we could be more flexible with when those units are being used. Because sometimes people, kind of get their healthcare in a cluster. So that's some feedback that I think would be helpful for DMS to be hearing from us. And then right now, as the state plan amendment was written and approved, licensed LPCCs and licensed clinical social workers can't order services. They are not considered an eligible provider type. Now, other mental health providers and other, Medicaid provider types are included. All of that information is listed out in the overview and the FAQs that I linked for you. So you can take a look at that. And then finally, there's been a lot of confusion, I think, for CHWs who are receiving some grant funding, or maybe, full grant funding that's currently covering their position. The way that Medicaid works is that, of course, Medicaid is already state and federally funded, right? So you can have funding that covers your position and the work that you're doing with a client, and then basically be double billing Medicaid, saying, I'm already covered, but I'm also going to bill you. No, that doesn't work. And that doesn't work for any Medicaid provider with any type of grant funding. But what can happen typically is that if you have, partial funding, and you're using that funding to cover people who don't have Medicaid coverage, or for services that aren't Medicaid related, like perhaps housing or food, or, any other number of issues that you're working with a particular client on, you can, use your grant funding to provide those services and then bill Medicaid for other services, as long as there's no duplication. We are still trying to get better clarification on this, because what I've heard from a lot of CHWs is that if they have any grant funding, they don't feel like they can participate right now in Medicaid billing at all. And I think that that's probably a misinterpretation, but we are trying to clarify this. And as soon as we get better clarification, we'll be sharing that out. But I think this is an area where we need to also be giving feedback to DMS and making sure that this is working in the way that it's intended, which is to provide as many services to Medicaid beneficiaries as possible. We can go to the next slide, Kelly. And then if you have any other questions, if you want to learn more, the Kentucky Office of Community Health Workers facilitates really fantastic meetings. They have quarterly meetings. They also have, I think, monthly meetings for certain groups. And you can see the schedule here. You can also just reach out to them if you have any specific questions, especially about certification, because they do manage CHW certification. And then if you have questions specific to billing, there's an email address here for that as well. So with that, I'll turn it over to Dustin to give us an economic update.
All right. Hey, everybody. My name is Dustin Pugel. I'm the policy director at the Kentucky Center for Economic Policy. And like we do on most of these, we're going to start with a quick overview of what's going on with jobs and the labor market. And then we'll talk a little bit about what's happening with our public revenue as well. So just to start, I say this every month, but it's still true. We are in the midst of a historic recovery. And in fact, in many ways, we have already recovered from the jobs we lost during the downturn. We have brought back 343 jobs out of the 294,000 that we lost since April of 2020. And it took us half the amount of time to recover what ended up being 3 times as many jobs as it took us to recover from the Great Recession. So we're actually 2.5% above where we were in February of 2020. And that's really remarkable, and I think a testament to multiple rounds of federal pandemic aid through checks that were sent out, through boosted unemployment benefits, through the Medicaid maintenance of effort, which we'll talk about later, as well as many other aspects. So let's move on to the next slide. And one of the questions that I think we often ask is, well, that's great that we recovered where we were, in February, but have we actually regained the jobs that we would have had nothing happen? And then the short answer is yes, we've actually exceeded that. We're about 29,000 jobs above where we would have been had things just sort of plodded along without any changes. So that's really great news. In fact, there's even been recent news that says there are more full-time workers than part-time workers in the US, that the prime age employment to population ratio has recovered. And we're actually just below sort of an all-time high with that nationwide. So, it's not perfect for everyone everywhere. The public sector is still struggling. Women have not yet caught up to where they were pre-pandemic. We still have higher unemployment rates for Black and Hispanic workers. But by and large, we're heading in the right direction and in ways that we haven't in a very long time. The folks who are still outside of the labor force are really the same kind of folks you might expect. We've had a lot of folks who have finally gotten to retire, particularly folks who are over 75 years old. We still have a lot of folks who are caregiving because of a sick or aging loved one, or because they can't find childcare. More on that in a little bit. And we have a lower workforce participation rate in Kentucky than we did before, partially because we've had so many folks die from COVID-19. So that had a real impact on so many parts of our lives and our economy, and our workforce is no different. Let's move on to the next slide. A lot of folks have heard recently that we have a historically low unemployment rate. That's true, and it showed up in our unemployment insurance claims. Unemployment insurance is really a bellwether for how the economy is doing as a whole. Most of our data sources that we get are about a month or more delayed. Unemployment insurance we get weekly.
Have to be somebody that you trust.
We can see what's happening pretty quickly with unemployment insurance claims, and what we've been seeing, we're still well below where we were, before the pandemic happened. So let's move on to the next slide. One aspect of what we're going to be talking about today when it comes to behavioral health, food assistance, Medicaid, is whether or not we can afford to improve these programs. And as it relates to that, we got to talk about what's going on with the income tax in Kentucky. So as folks will see here on the chart, the income tax is our largest single source of revenue for paying for all aspects of state government. The income tax is very directly linked to what we just talked about, with jobs growing, wages growing. So it's actually a pretty good source of revenue that links to the economy. And as of this past fiscal year, it made up about $5.8 billion of our general fund. So it's a lot of money. It's a very good revenue source. And it's actually better at growing with the economy than it was with than sales and use taxes. So let's move on to the next slide. And yet there is a concerted plan right now to continue to cut our income tax. So back in 2018, there was an initial reduction in the income tax. We went from a graduated income tax where the top rate was at 6% to an across the board 5% income tax. And then in 2022, there was a bill passed that set up a system of reducing the income tax further. And the General Assembly can take a vote to continue to reduce the income tax so long as the balance in our rainy day fund, often called our budget reserve trust fund, is equal to 10% or more of the general fund. And so long as our total general fund receipts, so our tax revenue, equals or exceeds our appropriation plus the cost of a 1 percentage point reduction in the income tax. So what that does is it, first of all, sets up an opportunity to continue to cut our largest source of revenue, but it also creates a disincentive for future spending, plus giving us less revenue to begin with. Along with that reduction, there also was a small increase in the sales tax by expanding it to additional services. But as folks can see here, those expansions in the sales tax only put a minor dent in what we're losing in income tax. And the General Assembly has been pretty clear. There's no plan to make up that deficit. Their plan is to cut and to leave our general fund smaller as a result. So let's move on to the next slide. To put this amount of money in context, this amount is actually slightly outdated. We probably need to update this chart, but reducing the income tax from 5% to 4%, as they have already done, is equal to $1.2 billion. It's actually a little more than that now. It's about 1.3 billion because incomes have risen since this chart was made. But to just compare that for a second, that's about half of what we spend on Medicaid. That's over half of what we spend on K through 12 base funding, so the state money for our system of public education. It's more than we spend on all of our public colleges, universities, and community colleges. And it's almost 10 times more than what it would cost to provide universal preschool for 4-year-olds. So it's a really significant reduction in the resources that we have to pay for all the things we care about and things that primarily benefit lower income folks, right? Think about Medicaid, think about people who go to public school, think about need-based aid and so forth. So it's a really important source of revenue for all the things we're going to talk about today and then much more. So let's move on to the next slide. At the same time, the folks who primarily benefit from reducing the income tax are top earners, which kind of makes sense. If you are earning, say, $1.4 million on average, as the top 1% of earners do in Kentucky, then you're going to end up with 20% of the total benefit of reducing the income tax. If you're in the top 20%, you're going to get 65% of the total benefit of the reduction in the income tax. Folks who live in poverty don't pay income tax, so they don't get anything out of this. What they end up with is fewer public resources for the programs that help them get out of poverty to begin with. Let's move on to the next slide. So the question is, are we going to keep cutting? If we went down to 3.5% of the 3.5% income tax, that would be equivalent to nearly $2 billion less in public revenue. And I don't know about you all, but I have a few ideas of how we could spend $2 billion in the state rather than giving it away primarily to wealthy individuals. We will find out in September when the end of year receipts come in, whether or not they've hit those 2 triggers that they mentioned. And at that point, the General Assembly will have to make a decision when they get back in session in January. Are we going to continue to give away our best source of revenue in the state? Or are we going to continue to invest in the things that make a difference in the quality of life for all Kentuckians? So I'm going to leave my update there and move on to our next portion, which has to do with childcare. So let's go ahead and move on to the next slide here. Childcare is a really critical foundational service in the state, and I think we really undersell its importance. It's incredibly important to the broader economy because we know that a large chunk of the workforce are parents. And we know that when there's not childcare available, it's primarily women and women of young children who are the ones who lose out on continuing to be employed. It's critical to the development of children. 90% of brain development happens under age 6. And so having high quality education and care is critical to improving their well-being immediately and later in life. And it's a critical part of the economy in its own right. We hire 3 times as many childcare workers as we do people employed by coal mining in the state, including miners. So it is a really important aspect of how our state runs, and yet half of the state is a childcare desert where there are either no childcare spots available or there are 3 times as many kids as there are spots available. This was back in 2018, this map. They haven't, the organization that ran this analysis has not updated it since then. And since 2018, things have actually only gotten worse. So let's move on to the next slide. So you'll see in 2018, we still had roughly 2,500 childcare centers. And since then, we've lost another 500. That over the last 10 years has been nearly half of our childcare centers closing their doors. That is a huge problem. Even if childcare was affordable, it would still be very difficult to find. And you guessed it, childcare is not affordable. So let's move on to the next slide. Childcare is expensive. It doesn't really matter where you live. If you live in an urban setting or a rural setting, it's hard to afford. The average full-time childcare for toddlers in the state is about $8,800. If you compare that to Western Kentucky University, you know, it's pretty close. I think it actually costs about the same to send your kid to childcare as it does to send them to Kentucky State University. So it is a really expensive service. And, you know, part of the reason why it's expensive is that there are student to teacher ratios that are really critical for safety. It's 1 to 6 for infants. It's up to 1 to 14 for preschoolers. You know, that's critical, but it means that we have to be able to pay teachers, and we don't even pay teachers that well. The average childcare worker makes under $12 an hour. So, you know, what we're facing is really a market failure where there's a really critical service that has high demand, yet it's unaffordable, and the providers themselves can't offer enough of it to meet all the need. So let's move to the next slide. There is assistance for childcare. It's the Child Care Assistance Program. Right now it's helping right around 30,000 children, but that's 30,000 out of 150,000 that are in childcare. So while it is improving and it's reaching more families, it still is not where it needs to be in order to help all families afford it. If you think about it, you know, this is the time in most people's lives when they need help the most. Parents of young children are at the beginning of their lifetime earnings. They're not making as much as they are going to make later in life. And yet their expenses are at the highest. Childcare, we've already said, is really expensive. It's usually right about when they're paying a mortgage or rent, as well as paying back student loans, which we're going to be doing for some time now. You'll hear more about that later. So, you know, childcare assistance is really critical, and it has improved in recent years. And so let's move to the next slide. So between 2020 and 2021, Kentucky received about $1 billion from the federal government for childcare. The largest chunk of that was through the American Rescue Plan Act. And that was split into 2 buckets. The first bucket was for sustainability checks that were sent directly to childcare centers. It was based off the number of kids at those centers, plus what the starting wage was for their workers. So the higher the starting wage, the more the money the childcare center got. That's been about $33,000 a quarter and has really helped childcare centers in a lot of ways keep wages high and tuition lower than it would be otherwise. And then the other chunk of money was for the Child Care Development Fund, which is the primary way that we help pay for childcare assistance. And that's been able to increase the eligibility limit, increase reimbursement rates, and so forth. Combined, these have been about $300 million a year. And that's really stabilized the industry. It's helped make sure that more people can afford it. It's expanded the services. It's actually induced new centers to open over the last couple of years. But all of that money is running out. The largest chunk of that, these sustainability payments, end at the end of this year. So centers are not going to get direct checks next year to help stabilize the industry. And then by September of 2024, those additional funds that help boost childcare assistance are also going to be gone. So we are facing one of the most catastrophic hits to the industry that our state has ever seen, and that starts this year. So at the same time that General Assembly is going to be considering another income tax cut to the tune of about $800 million, they're also going to need to fill a $300 million hole for childcare. So again, I'm just going to finish with that question. What's it going to be? Are we going to continue to throw away our public revenue and hand it over to wealthy individuals? Or are we going to help support one of the most vital industries, the industry that supports all other industries in the state, and continue to invest in childcare? So with that, I'm going to hand it over to Jessica. She's going to talk a little bit about food assistance.
Thank you. Hi, Jessica Klun, Policy Associate at Kentucky Policy, and definitely have some key updates for you today around SNAP and pandemic EBT, along with a few other food assistance programs. So to get us started, a little bit about the state of hunger in Kentucky. About 1 in 6 people face hunger. That's 1 in 6 children. We also have the second highest senior hunger rate in the United States, unfortunately. So yeah, right now about hundreds of thousands of our neighbors are just one lost job, paycheck, or emergency away from hunger. So it's a huge problem in Kentucky, and luckily we do have a set of food assistance programs to help us with that. So next slide. So these are some of the key food assistance programs that we see in Kentucky. Number 1 being the Supplemental Nutrition Assistance Program. SNAP, previously known as food stamps, serves over 500,000 Kentuckians, and I have a really good map for you later about that. But it's based on your household size and income is how you determine how many benefits you receive for that program. We also have the WIC program for women, infants, and children, which is for pregnant, breastfeeding, or postpartum women, and then children under 6 with low incomes. The school breakfast and school lunch programs, and then pandemic EBT, which I'm going to talk a little bit about today, which is the program that helped to provide meals while schools were closed throughout the pandemic and is now transitioning into a summer program as well. So I'll share a little bit more about that next. So I wanted to dive into the SNAP program a little bit and just show you a little bit on our participation rates. SNAP works. It responds quickly during economic downturns, and you can kind of see that reflected in this chart. But I think too, it's also impacted by administrative policy, and a lot of the dips that we see here are, you can see, are related to years where there were changes in administration or new SNAP policies, for example, reporting requirements, which I'm going to talk a little bit about next slide. So this is what SNAP looks like across the state of Kentucky. As you can see, we have a wide range of SNAP participation. I think, the average is about 12.3%. So, but a large range across the state. And the benefit range is large as well. So the lowest amount that you can receive is $23, and the most being $283. So it's, again, based on household size and income, but that is very much a supplemental program. It does not replace the entire family's food budget. Next slide. So there are several deductions that can change, again, that calculation of your benefits and really make sure that you're getting all of the SNAP benefits that you're eligible for. So if you do know somebody who participates in the SNAP program or is newly applying, it's really important to consider these possible deductions. So there's deductions for things like housing, for child support, for shelter and utility costs. So yes, lots of new and important deductions there to consider. Next slide. And our most recent update is around the SNAP time limit, which is the work reporting requirement for people without children or disability between ages of 18 to 49. And that started this month, restarted. It was on pause during the pandemic. And so that means that it's restarting, in this newly reestablished requirement is coming back into play for about 17,000 Kentuckians who will have to report their work hours to continue being eligible for SNAP. The last time that this was in play, about 33,300 Kentuckians lost food benefits. So it's likely that we'll see some Kentuckians lose their food benefits. So it's really important that we get this message out that this requirement is coming back. Also recently in the debt ceiling agreement, this requirement was expanded to people 50 to 54 as well, which is an additional 13,000 Kentuckians. That new requirement for that age group is not going to start until September because we're still kind of figuring out how that's going to be implemented in states. Along with that, with the new agreement, the new policy also has new exemptions for people experiencing homelessness, veterans, and people aging out of foster care. So those new exemptions that people might qualify for, which means they wouldn't have to do all of the reporting, is also going to start in September and October. So more information coming about those as well. Next slide. So some counties are currently exempt from the SNAP time limit based on the economic status of their county. So you can really see here, where the majority of SNAP participants are that are going to have to do that reporting in the counties that have been exempt. There's also a set of exemptions for individuals to consider as well. Things like your disability status, being pregnant, those kinds of things can also be counted as an exemption. So those are available as well to take a look at to see if you might be exempt. Next slide. Okay, switching gears from SNAP a little bit on the pandemic EBT program. Couple of updates for you here. Again, this makes up for missed meals during the school year due to the pandemic and also covers additional grocery money during the summer for kids that participate in the National Free School Lunch program in their school. So for this year, and again, this kind of changes year to year. So if you've heard something about it in the past, it might be different this year. So for this past school year, there is new information coming out. So for families with children under 6 on SNAP, again, they wouldn't have had a child in school, but potentially in daycare, they have automatically received their pandemic EBT benefits for the last school year onto their EBT card in June. So if you know somebody that qualifies for SNAP and has a child under 6 and they didn't receive that, then they can call DCBS for more information. For the school age group, so kids over 6 to 18, there is a new version of PEBT coming. It's likely that there will be an application this round, which is a little bit different from previous rounds. And we're looking at August for that application. That application can be found by talking to your school or through the Connect website. So we don't know what it looks like yet. It hasn't been uploaded yet. So more information coming on that application, along with the amounts of benefits that people will qualify for and any other requirements that go along with this year's PEBT program. And finally, the summer PEBT. So that's the amount that families are getting during the summer months to make up for missed meals. And that's really when child hunger is at its highest. So that's why this benefit is so important. And it's actually going to continue. So even though pandemic EBT has been based on our pandemic status, summer EBT will become a new program starting in 2024. So that's very exciting to see that program continue. But for this year, kids will receive about $120 per child, and we're looking at October for that money to go out. So it's likely that the school age plan will come out and that application will be open, and then the summer benefits will be added later. So the timeline is a little bit slower than we're used to, but it's coming along. So next slide. So I did want to mention another recent change in federal policy, which is related to the one type of fraud that is prevalent in SNAP, which is EBT skimming. So what happens with EBT skimming is that people use their EBT card. It looks like a credit card to pay for groceries at a participating store or market. And what happens sometimes is that there are different, skimming things that take money off of that card for that individual. And unfortunately, up until now, the USDA has not replaced those food benefits for people, even though they've been stolen from them. And the pictures here are examples of machines that have skimming on it, and you honestly can't tell the difference. So it is very common. But what the new plan is going to do is replace benefits for people that have lost their food assistance through EBT skimming between October 2022 and September 2024. So we're hoping that this will become a more permanent solution for EBT skimming. But we're currently looking at a process to review skimming from the 2022 to 2024 dates. So our plan for Kentucky has not been approved yet, but more information will be coming about how to replace those benefits soon. Next slide. And I think with that, I just wanted to lift up the opportunity to advocate for, some permanent solutions to some of the programs that I mentioned, which would be the Farm Bill, and the Kentucky Food Action Network is the way to get engaged with that advocacy. So hope you can join us. Next slide. Okay, turn it over to Marcy for behavioral health.
Thanks. I am Marcy Timmerman, Executive Director of Mental Health America of Kentucky. Go ahead and change the slide here. Thanks. It is the 1-year anniversary of 988 coming up next week on the 16th. So we wanted to quickly acknowledge that birthday and be like, yay. And what really does that mean? Over 40% increase in calls. The number varies a little bit by 1 or 2 percentage points, but it's always over 40. We have increased answer rates and times to answer. It's under 20 seconds for most callers as soon as they get through the prompt of 1, 2, or 3 to push to get through. So that's pretty awesome. We're not the best in the nation, but we're pretty close. We're in the top 5 pretty typically with answer rates. So that's really looking great for Kentucky. We have increased our first responder workforce in the form of these crisis call takers. We have hired and added volunteers and other folks to help take that burden off of some of our CMHCs, spread the burden amongst those folks. So we've done a really good job with that. There are still some jobs open. So definitely check out 988.ky.gov. I'll put that in the chat in a little bit if you're interested in those jobs. We added text and chat to 988. You can now text 988. You can chat with it through the 988 website. And those are national features. We are working to add more of a statewide response. We have Pennyroyal doing some of that during limited hours each day, but they're the only ones doing that locally. So we are working to increase our statewide presence on that. You will still get someone though, if you text or chat. Let's make sure that that's clear. This is a nationwide network we are part of. We just really pride ourselves in being able to answer Kentucky problems with Kentuckians. So they added Trevor Project as a number 3 option on the phone tree. So if you hit 1, you're a veteran, 2 for Spanish language, and then Trevor Project is for our LGBTQ folks. And they did that as a response to national surveys and information and feedback from the LGBTQ community. They don't want necessarily a CMHC person who they may know, right? They don't want someone from a community mental health center in their county to take their call, and that's fine. So they are getting put through to Trevor Project, which has been doing these kinds of calls for decades. So next slide, please. It is BIPOC Mental Health Month. For those of you who are familiar and been in mental health for a while, it's the B.B. Moore Campbell Minority Mental Health Month. That's still the federal language. But most of us have chosen BIPOC just to get rid of that word minority. And Mental Health America of Kentucky's stuff is up live. You can click this in the slides and get to our toolkit that has our logo, but you can also go to the national mhanational.org/July and get the entire toolkit. Just the logos will be for the national, and we don't care how you get it. Access it. We know that our lives are deeply intertwined with our environments, right? So culture, community, and connection, especially in our BIPOC communities, but honestly, this speaks to all of us, I think. So it's really cool to pull out this community building, really combating loneliness and isolation, and looking how to improve ourselves, not just as individuals, but as a community, as a state, and at the larger level. Next slide, please. Thanks, Hannah, for that link. So Medicaid waiver for Kentuckians with severe mental illness. We do have this 1115 waiver, and I think we've covered this in previous groups. So correct me if I'm wrong, folks. But the 1115 waiver is entitled Improving Mental Health Outcomes for Individuals with Serious Mental Illness and Health-Related Social Needs. There are some great things in that. However, it does not provide the supported employment and supportive housing that we know that we need for our folks with serious mental illness. So we are still pushing the cabinet, and we hope that you are with us in really advocating for a 1915I is what that's called. So it's a 1915I waiver to help us use Medicaid dollars to really go where they're supposed to be. Supported employment and supported housing are so much cheaper in the long run than the constant revolving door that we have right now. And I think anyone who's ever dealt with someone with severe mental illness can attest to that. So next slide, please. And then a couple of harm reduction updates. Opvi is a nasal spray. It's FDA approved. There's some questions about, well, is it the new Narcan? Maybe, maybe not. Their claims are that it lasts longer, but it also has some side effects that last longer. The typical withdrawal side effects that come after a Narcan spray, they disappear pretty quickly after Narcan. Opvi, they take up to 6 hours to disappear. So it's a lot longer. So there's some ups and downs. I actually, in the slides, have a pretty good overview of that by Brightview. They are a for-profit substance use place. So I'm, disclaimer there, they are not somebody that we are necessarily promoting as an individual entity, but they have a really good outline of, the pros, the cons, and where we are at in the research with that. It is now FDA approved though, and I'm always for options, right? Folks can research and find out more. And then I wanted to mention House Bill 353 in the General Assembly. It is now in place. So it has removed criminal penalties for owning fentanyl test strips and other drug testing equipment. So yes, those of you who may not be familiar, all of us who owned those before had drug paraphernalia and could have been arrested. So thankfully, that's not the case now. We are in cover. So this is great. And there is an MSN article here if you want to learn more about that bill. It's actually pulling a WKYT article, but I couldn't find the original WKYT. So we're stuck with MSN. But I think that's a good seg for our legal update, which I think is coming from Stephanie Evans-Kingsley.
Indeed. Good afternoon, everybody. Stephanie Evans-Kingsley with the Kentucky Equal Justice Center, covering for our fearless health justice attorney Chloe today, who is in Chicago at our Racial Justice Institute. So the Supreme Court wrapped up its term, thank goodness, forever. They can't do anything else for the rest of the year until the fall. It was a mixed bag this term, some really good surprises and some really terrible not surprises. So the first one as it relates to both public benefits, Medicaid specifically, but also deals with SNAP and other spending programs that are identified and regulated in federal law. There's been a movement to try to remove the private right of action from a lot of federal spending programs, simply because that's just the trend in the law these days. But Supreme Court reaffirmed that the rights of public beneficiaries to sue state officials in federal court when they violate their rights under the federal law is going to continue to be allowed. The whole concept is that state actors cannot protect the federal rights of individuals. And so really there is no other remedy for them in that space. There's an interesting development in the concurrence, one by Gorsuch and one by Barrett. They're basically trying to leave open the path for other challenges to the spending clause private right of action. And in particular, because the private right of action comes from Section 1983 specifically, which is a very broad statute that is grounded in individual rights, and that there are other programs and federal statutes that do not have that same or similar broad application. So the private right of action does not apply in all federal statutes and really just wants to limit this, ruling it to the 1983 claims specifically. Moore v. Harper was a fascinating look into the minds of states who would like to have complete and total control over their elections. The independent state legislature doctrine basically looks at the text of who should govern state elections and basically saying that the state legislature should have full and unfettered authority to run their elections how they see fit, and that federal government should have no say whatsoever. This would be an enormous departure from how elections have been run, both federal and state. And the Supreme Court rejected both the merits of the argument and the jurisdiction of the plaintiffs in the concurrence. But basically, democracy has survived to live another day. They ran through a bunch of different reasons why this is an absurd legal theory and basically just rejected it outright, which is one, a surprise, and two, really great news for democracy. On to the bad news, Biden v. Nebraska. So I'm sure you all heard that the student loan forgiveness program was struck down. It was struck down with this court's favorite legal theory, which is a major questions doctrine, which has absolutely no founding in precedent or statute, and is basically something this court has made up to overturn actions of a Democratic president when they do not like the expansion of executive action. So they said because there is no statute that specifically gives the executive branch the authority to do this, that they can't do it. And so it appears that the administration was prepared for this ruling. The new repayment plan options are rolling out that are grounded specifically within the Higher Education Act. And I think it's a very unique strategy and also sort of terrifying, because the public service loan forgiveness project that's been in existence for, and I've been practicing 20 years, for more than 20 years, is how the Secretary of Education puts those rules and policies and subsequent regulations into place for forgiveness of loans under certain terms and conditions. So clearly this is going to be challenged again. I hate that they're using the public service loan forgiveness sort of vehicle for it, because with this court, you never know how far they're going to go. And getting rid of all of the secretary's discretion for interest rate reductions, setting of income-based repayment plans is a little bit terrifying. But the new repayment plan will look to, in those income-driven repayment plans, really cap the interest so that whatever your monthly payment is based on your income-driven repayment plan, whatever interest is paid in that monthly payment is the only interest that will accrue. So we won't have what we see right now, which is everyone's in these income-based repayment programs and those balances continue to rise because the interest isn't being covered. This would allow to pay down and not just have continual interest rate accrual. Some of the changes that they're going to have to go through rulemaking for is going to be changing that income-based repayment program to 5% of an individual's discretionary income instead of 10% of their discretionary income. So not only are they making changes to the income, the interest rate accrual, but also how are those monthly payments established and what is the maximum that a person can pay. So I think it's going to be interesting to see how this one makes its way through the system, but I think they're being really smart about what next step is going to be. Some of Chloe's footnotes here for what the Supreme Court did. Jones v. Hendricks was a really unfortunate federal habeas corpus case in which basically they really limited the opportunity for individuals who are convicted of federal crimes to bring their habeas petitions. It is a Justice Thomas majority opinion, which really just restricts inadequate or effective to test the legality of their conviction is the new standard that he's putting forth for habeas petitions in federal court. And I think Justice Jackson says it most succinctly in the dissent that she filed, that basically his legal theory and new standard says unless the courthouse has been wiped away in a mudslide, there is no way that it could be inadequate or ineffective to test the legal conviction of that individual's case. So it is really unfortunate for folks who are serving on federal gun crimes, and we were really looking to see this as a vehicle to get a lot of folks out with these bogus charges, but unfortunately, that will not be the case. Harvard and UNC affirmative action cases, no race conscious admissions in higher education. I think this case could have been worse, but it's still not great. What it still allows is universities to consider an applicant's discussion of how race has uniquely tied to their experiences, to a quality or aspect of their education that they are bringing to the university. So basically they're saying that experience of the individual can be used in the consideration, but it cannot be on the basis of race alone. What does that mean in reality? It just means that we are going to see some really risk-averse academic institutions take this a little bit too far. And it'll be interesting to see what comes out of this. But right now, so it struck down Harvard and UNC's, and that's basically anytime that you have a diversity statement or a checkbox, or you're tracking these individual applications on the basis of race, even collection of that data can get you in trouble. And so a lot of universities are looking at even the application process, making it race neutral, and having more essay style statements of a person's experience to get around that prohibition. So Allen v. Milligan is one of the best decisions to come out of the court. The Voting Rights Act still exists. Section 2 of the Voting Rights Act, it can still be used by individual Americans who believe that the cracking and packing of their congressional districts has really impacted the access to the ballot box for Black and Brown Americans. So this particular case looked at the percentage of individuals who are in the state versus how many districts there were. So there are 7 districts, 27% Black voters. And so section 2 of the VRA still requires that old adage of one person, one vote. So if this is the percentage of the population, you cannot pack all of your African-American citizens into one district and then crack them everywhere else in the remaining 6. So an interesting note on the Voting Rights Act cases that were heard on the shadow docket before their term. For those of you who are not law nerds like me, shadow docket is when things are heard on an emergency basis. No opinions are written necessarily, but the Supreme Court can act or not act while the final resolution of the case is pending before them. And so with this particular case, there were 3 districts that had been impacted by this case and by the permission of the Supreme Court to allow these illegal maps to go into place. Means that we have 3 districts who now have individual representatives who should not be there, because the final outcome of that case is these were unlawful discriminatory maps as they were written. So it's just, we don't need it anymore because we had the 2022 election and we got the House that we got. But now that we're past that, oh, by the way, your maps are illegal and you need to redraw them. So hopefully this will not be an issue in 2024. We will get that 2nd district in, I believe it's Missouri. I'm sorry, terrible with states and my notes. And then, of course, the last and final day of opinions, we got 303 Creative, which basically says that on imaginary evidence, when lawyers have lied about the facts of the case, the Supreme Court will not care about that and will still allow private businesses to refuse service on the basis of their exercising of free speech for individuals who LGBT individuals for whatever case they have brought to the business. So this particular case was similar to same-sex wedding services. They wanted to create a website for same-sex wedding. This particular individual, it's unclear if she's even ever really created a wedding website, or that the individual who applied for her wedding website was really a real human, but still she got the outcome that she wanted, which is an imaginary hypothetical that the Supreme Court said, no, absolutely not. We cannot expect you to treat all Americans in your business the same, and you have the right to discriminate based on your free speech. Kentucky litigation specifically for SB 150 is a little bit terrifying, simply because of what the Sixth Circuit allowed to go into effect in Tennessee. So right now, the challenge to SB 150 is, so basically where we are at with the ACLU is that due to go into effect June 29th, the federal judge hearing the case granted the ACLU's motion to temporarily block the provision. There are lots of these cases going through the courts in lots of different circuits. This is going to end up before the Supreme Court at some point. We're just working our way there. What is important about the Sixth Circuit Tennessee case is it's sort of a wackadoo decision. So basically they're relying on Dobbs for the abortion case, and there is no set of circumstances that can exist where a statute would be valid. And they're saying the Sixth Circuit has no authority to dilute that standard in Tennessee. So basically, if we can imagine a hypothetical in which these individual bans could be valid and not discriminatory, then they don't have to overturn the statute. I thought the language in the Sixth Circuit's order was sort of hilarious as a law nerd. The Sixth Circuit found that the Tennessee legislature will suffer irreparable harm by not having their laws placed into effect. For the irreparable harm standard, it's usually to an individual, that an individual will suffer irreparable harm if we do not enter this injunction. To really turn that protection standard on its head and to say the Tennessee legislature is going to suffer irreparable harm if their laws aren't allowed to be the mandate of the land is a really terrifying turn of events in an injunctive relief legal standard. So I am hoping that is not something that the Sixth Circuit continues and is really just specific to the snark in this case. But it is incredibly possible that the failure to find gender discrimination and the failure to find a violation of equal protection will be the same result, given the Sixth Circuit's analysis in this case. The other piece of the pie to that argument is they're saying because it's a new legal theory, injunction shouldn't be entered because your likelihood of success is unknown because it's a new legal theory. That also is not found anywhere in federal or state statutes for injunctive relief. So this also seems to be another hurdle that they have artificially placed in front of the litigants who are seeking stays and injunctions against these bans. The abortion ban litigation ended up with an agreed order to dismiss, same rules and circumstances in Dobbs that ended up with the wonky ruling in SB 150 or with the Sixth Circuit case in Tennessee is why the EMW and Planned Parenthood team agreed to dismiss the case, is because the Dobbs standard is just too high to overcome in litigation like this. So unfortunately, that one is also now concluded. And I promised Chloe I'd be fast, and all of a sudden I'm talking a lot about these cases, and I'm sure my 10 minutes has long gone. So Emily, please just cut me off at any point if I'm not moving quick enough.
We do
think
need to.
I'm sorry.
No,
We'll be
super
sending
good.
these out, and we'll plan another litigation update for the next month too.
Yeah, she packed these 3 slides full, and I was like, 10 minutes, got it. Not a chance.
It's never easy.
Okay, well, here I am, Adrienne Bush with the Homeless and Housing Coalition of Kentucky, and we will move through this quickly. Since last month, wanted to highlight that the National Low Income Housing Coalition has co-released its Out of Reach report, where they do the really hard work of trying to figure out how much it actually costs to pay for housing among the different states. As you can see, Kentucky is number 46. That means we're relatively affordable compared to some other places in the US. We are not necessarily affordable for us, those of us who live here. The state housing wage, what it costs to pay for a 2-bedroom rental home, went up over $1 to $17.90. I'm sure everyone on this phone call knows very well our minimum wage has stayed the same at $7.25. While we have had some upward pressure on wages, very much appreciated, the cost of housing is continuing to outstrip them. You can look up this report and look up your local community if you're interested in learning more. Next slide. Why does housing cost so much? Because we have a deficit. We have a shortage of supply, and it's basic economics from my understanding. This year, our shortage of affordable homes, affordable to extremely low-income Kentuckians, is close to 90,000. Next slide. Okay, so disaster housing update. Lots of things happening / not happening at the same time. So I'm going to try to provide some clarity. There is a federal grant called the Community Development Block Grant Disaster Recovery, CDBG-DR. In 2021, we had some really bad disasters then that included flooding in Eastern Kentucky, as well as tornadoes in the western part of the state. That plan for disasters that happened in 2021 made available about $87 million for housing developers who could then apply for the money, and then people would be able to go to their local community housing development organization, their local habitat, et cetera, to be able to apply for assistance. About 18 months after the tornadoes, this funding was finally made available to housing developers in May and June of this year. The funding window for applicants is still open. Next slide. All right, so we also had some disasters in 2022. And when I say flooding in Eastern Kentucky, you're probably thinking of that from last July. At this point, the overall allocation for CDBG-DR has not, the total amount has been determined is $298 million. People are pretty familiar with that figure. But the plan that determines how much of the $298 million goes to infrastructure or local governments or housing has not been determined yet. It's currently sitting at DLG being developed, the Department for Local Government, which is administering the 2021 plan. There is a survey open if you are in Eastern Kentucky and you want to help inform that. In the meantime, the legislature did create the Rural Housing Trust Fund, $20 million to be administered by Kentucky Housing Corporation. We anticipate that applications for developers for housing in these regions will happen in July. A second round of funding for housing developers who may not have been ready will be ready later this fall. Awarded developers will then allow for household applications. Next slide. Okay, and at the federal level, the Federal Housing Finance Administration, which is an acronym FHFA, that most normal people do not even know about, but they have a great deal to do with the housing finance system in our country. And they are requesting some input for tenant protections at multifamily properties that are backed by things like Fannie Mae and Freddie Mac, which you may have heard of. So their goals are to gather perspectives from people, real people, as well as advocates that I sometimes lump in as real people, and then other industry providers. And then to improve data collection to better quantify the size and scope of challenges that tenants experience at multifamily properties. Next slide. So some of the ideas that our national folks are kicking around and that we have kicked around here in Kentucky are source of income protections, just cause eviction standards, anti-rent gouging protections, and then obviously safe, decent, accessible, and healthy housing. There are a couple of ways to participate. You are short on time, and you represent an organization, I'd encourage you to sign on to this letter that's developed by the National Low Income Housing Coalition. We will be providing input. So if you want to provide input to me, let me know. And you can also write your own letter if you have more time. And there is a template for that. And then there's a specific comment collection website at tenantcomment.org. All of the comments will be available publicly, so please be careful in releasing any sort of personally identifiable information. And you can upload things to FHFA's portal, where again, you can see what everybody wrote. Next slide, and I believe I'm turning it over to Priscilla.
Thanks, Adrian. All right, y'all. So we are going to run through this. We are in the third month of Medicaid renewals. They restarted back in April. The first batch were due May 31st, June 31st, and then every month through April 2024. And then after that, things moved to just the regular annual renewal process. So this is really a return to normal. We love to drill that in. This is a return to normal. The first year is just a little bit more complicated because it's turning on systems, it's unwinding a lot of flexibilities, and a lot of this has not been done in 3 years. So there are lots of opportunities for technical difficulties and problems and issues. So we are working really hard trying to identify those and report those to the Department of Medicaid Services. So as of right now, we are, like I said, as of July 11th, we are in the third month of renewals. 150,000 of the 960,000 cases have gone through the renewal process as of the end of June. Around 77,000 of them, 78,000 of them have been able to be successfully renewed, had their coverage continued for another 12 months. The rest of them have been terminated since April. 71,000 folks have been terminated from coverage, and around 53,000 of them have been because they have not responded to a notice. So we're trying to make sure that people know what's going on. So the biggest thing that we have talked about over the last year is make sure that contact information is up to date and connect. If you get notices and you're not sure what to do, or if you know people who are getting notices and they don't know what to do, please, please, please reach out to connectors. Connectors can walk you through this entire process, help submit documentation, and just really take the burden off of clients as they're trying to walk through this process. And some of these things are pretty confusing. If you need some resources to hand out to clients, the state has their unwinding page, medicaidunwinding.ky.gov. We have, KVH has a Medicaid renewal explainer that's now available in Spanish as well. And then our friends at KY Policy put together a really great, like long form, here's everything that's going on, and it's a really great reference piece. If you need help checking renewal dates, you can do that. They're available in the system. You can go to connect.ky.gov and check your self-service portal. Reach out to a connector, they can check it for you. If you go to a doctor's office, providers can check it in KY HealthNet, or you could call the Connect hotline and they can tell your renewal date at that point. Next slide, please. So over the next 12 months, these are the 3 notices that everyone is receiving. The notice of eligibility, and that's just saying, hey, we've checked your eligibility, your information looks good, you're extended for another 12 months. You don't have to do anything. There's the request for information, the example or RFI, that's going to ask you to submit some sort of documentation. And so you do have to respond to that. And other folks are getting that full renewal packet, which is going to be a copy of all of your information that's on your Medicaid application. And you just have to go through, verify that all that information is correct, sign it, and then submit it. And you can mail that in back to DMS and they will process it. Next slide, please. So as I said, this is going to be spread out over the next 12 months. For July, this is the first month that they are prioritizing folks who are eligible for a qualified health plan. So this is the group. They were trying to postpone all of this until July, and so they could get some systems and pieces in place so that they could do those direct connections and referrals for folks who are no longer eligible for Medicaid, but are likely eligible for a qualified health plan on the marketplace. So this is the first month that they're going to run those. And those will be due at the end of this month. That takes additional action. So make sure that you check out, look for notices, check Connect account, and again, reach out to connectors if you have any questions about any of this. Next slide. So this is just a quick overview for June. There were 79,382 individual renewals due for June. Like I said, 39,000 of those were approved, but 37,000 were terminated, and 29,000 of those were because they did not respond to a notice. That's why it's so important that we're trying to make sure that folks know that they have to respond to notices, because these are not people who are losing their coverage because they were deemed ineligible. They lost their coverage because they did not respond to that notice. So again, reach out to connectors, reach out if you have any questions or concerns or any of that. Next slide. DMS is doing a lot of outreach, so they're calling folks 3 times before their renewals are due, and then in the month after that they missed responding to a notice, they're also getting personal calls from the call center and Department of Medicaid Services. They're also sending out texts and emails and all of that as well. So again, also important that the contact information is up to date so that they know who they're calling and they can answer the phone. Next slide. This is a big ask. So every month, the DMS hosts a stakeholder engagement meeting. It's the 3rd Thursday of each month. The next one is next Thursday at 11 a.m. Join it. Everyone is invited, and you can ask them all of your questions directly. You don't have to come here to get all of your questions answered. You can ask them directly, and they are happy to answer them. And if there is a link to the survey, and you can submit those questions ahead of time to make sure that those are answered. Next slide. Gosh, I forgot how much content I had. So if you lose coverage, reach out to a connector. There's lots of opportunities to get your coverage reconnected, to get back re-enrolled into that coverage. Reach out to a connector and they can help you through that process. That's the biggest thing. Just talk to a connector. Next slide. Next slide. Maybe. Okay, well, I can talk more about reconsideration period. Great. So if you don't go back to the reconsideration period, if you can't get back into your Medicaid coverage, you can still get covered outside of Medicaid. And there are 4 different types of special enrollment periods, or 3 different types of special enrollment periods that are available for both Marketplace. Those are typical qualifying life events. Next slide, please. There are special circumstances, exceptional special enrollment, and then there are also Medicare special enrollment periods. If you do need to get connected to a QHP, there are also agents that are available. Connectors are a free resource that can help with Medicaid, QHP, SNAP, CCAP, and other programs. Licensed insurance agents are paid a commission only to help with Marketplace enrollments. So just understand that difference, but they're still also available to help. Next slide. And just be aware, we continue to hear a lot of stories about people getting contacted from random insurance companies trying to sell them junk plans. There are only 4 qualified health plans in the state of Kentucky: Anthem, CareSource, Passport, and Better by WellCare. Any other company, just be aware and ask for something in writing. Do not pay anybody over the phone. Next slide. What other renewal issues are happening? We're hearing a lot of specific concerns with people enrolled in waivers, people who have 0 income, the income information is not up to date and Connect, people who have SSI who are getting terminations. If you have any stories, any cases, any sort of information about what's going on, please reach out to us. My contact information is right there, but you can also post it on KY Loop, which we are now debuting, and we're using this forum as an opportunity. We're using the forum piece of KY Loop to really have those conversations and report issues about what's going on the ground. And keep track of that stuff. So you'll stay tuned for more information about KY Loop. And again, if you have any issues, know of any problems with the renewals, please reach out to us. And that should be it. Next slide. All right, thanks, Emily.
All right, well, thank you all for sticking with us and rolling with our timing. We try to do the impossible every month, but there's just a lot of information to get through. We want you to have these updates. We'll be sending out everything out as we always do. Lots of resources will be in your inbox soon. And I forgot to mention that if you're a certified community health worker or a licensed social worker and you want CEUs for joining today, we can provide those to you, and Kelly will be the person to help you with that. So we'll send out more information about that as well. So thank you all. We have some great explainers, and Priscilla mentioned one of them that will also be flagging for you because these are going to be something that you can use in your community to talk about Medicaid renewals, SNAP, special enrollment periods, and so on. So keep an eye out for those. And we will see you next month when we have our forum with the Cabinet for Health and Family Services on August 1st, if not sooner, in Hazard, if you want to join us for our roadshow. So thanks a lot. Have a good afternoon.